If a man's semen is too thick, how does it affect the sperm and also affect fertility? You know, semen is the one you can see with your eyes without using a microscope. The one that, as a man, as you ejaculate, that white gray stuff that comes out, that is the semen. Okay, but inside the semen is found the sperm, but you cannot see the sperm with an unaided eye if you're not using a microscope. Okay, now how can you having a thick or a very thick semen affect your sperm? It can affect the movement of the sperm. Okay, having a very thick semen will make it difficult for your sperm to travel to meet the egg which your partner has released. Number two, if the semen is too thick, the sperm cells found in it will find it difficult to move freely, like I said, and also find it difficult to move towards to the egg which has been released by your partner. And if the sperm cells found in it cannot move towards the egg which has been released by your partner, getting pregnant might become a problem. Okay, there are many causes to a man having a very thick semen. Number one, it can be dehydration, it can be infection, it can be hormonal, it can be prostate issue. But we're just looking at dehydration being a cause today. If you are a man and you notice you're having a very thick semen, okay, your semen is very thick, it's good for your semen to be like, viscous, kind of jelly like, not that thick. If it is thick, like I said, it can affect the sperm cells found in it, making it difficult to travel, and that will also result to difficulty in achieving pregnancy by your partner. So if you notice your semen is very, very thick, you should increase your fluid intake, because dehydration is one of the causes of this thick semen. All right, so when you increase your fluid intake and you still notice, despite the increase in your fluid intake, you're still having a thick semen, I will advise you to go to the hospital and see a doctor. Probably they should check other things and see if the cause is not just dehydration. Maybe it could be from another source. All right, whenever you pass urine and you notice bubbles or foams in your urine, notice that your urine is foaming, like something like this. Now, if it is your first time of passing this kind of urine, if it's your first time of noticing this, what you should do is to increase your fluid intake. Okay, when you increase your fluid intake, do not hold your urine. After you have done that and you notice this foaming urine or this bubble urine happens again, what you should do, you should go to the hospital and see a doctor, see a healthcare provider, okay, so they can run some tests for you. Because when bubbles or foam, like kind of your urine is foaming, it indicates protein in the urine, which could be a sign of underlying serious health issues. So you don't just overlook it, don't ignore it. All right, hiding it or just keeping silent or ignoring it won't make things get better. Okay, it can only make things worse, especially if that foaming urine or bubbles found in the urine has to do with something more serious. Okay, it can only complicate things and make things more worse. All right, early interventions matters a lot. You don't have to be scared of accessing the hospital or accessing the healthcare personnel. Always feel free. We're always there to attend to you guys. All right, bye.